Hello there, my name is Gregor Reed, and this is Probiotics, a story about hope. Disclosures: I consult for Seed, a company producing symbiotics, not mentioned in this presentation. What are the learning objectives? Well, there's 4. To understand what probiotics are, what they're not. The answers will surprise some of you. To describe how the field came from nothing to the present day, from my own story. To encourage people not to give up when it seems like the world is rejecting your ideas, and to suggest that we need to try and pass on our innovations to people around the world, including those facing the greatest social challenges. You come to a point in your career where stuff, meetings, politics, frustrations, repetitions, they start to get to you. And you publish another paper, you publish 600, you think, oh, there's another one matter. It's not for promotion. You travel the world, seen places, don't really need to see anywhere else. So that's not a reason to retire. But when they asked me, or offered me, retirement in 2019, I thought, why not? Luckily, just before COVID. But decisions like that, they're more mental than anything. What will I do with my time, and can I give up the income? Will there be a buzz that I'll miss? And interacting with people, will I miss that? In the end, it was the right time. I felt younger people with newer scientific techniques and ideas deserved the opportunity, and freeing up my position would give them that. And I enjoyed writing. And suddenly I got ideas that led to 7 crime novels under the pseudonym John G. Leslie. But having to publish another one under my real name is what happened next, and it's why Kelly asked me to give this talk and talk about my book, Probiotics, the story about hope. Maybe a last-ditch effort to show the world that too many people are getting the term probiotics all wrong, and encourage young scientists not to back down in the face of adversity. Anyway, this is my presentation on the book. I hope you enjoy it and get something from it. So here it is, Probiotics, the book cover. The front cover of the book, created by Friends with Talent. You can see the little honeybee down the bottom left. Available through Amazon, because I don't have an editor, a marketing department, a promoter, or an influencer. It's just me. Showing the microbes, reminding us the field is about more than just humans. It's about planetary health. And since it's a story, not a textbook with figures and tables, I'll guide you through the chapters as best as I can. Nice notes on the back from very special people. Glenn Gibson, highly renowned scientist, basically came up with the term prebiotic. Dan Merenstein from Georgetown University, a physician. The Alliance for Education on Probiotics, a professor who benefited from probiotics, and Ara Katz, co-founder of Seed. So it was wonderful to get their impressions on it. So the background to chapter 1, I was told in primary school I'd never get any O-levels. That's what was the term, the exams in Scotland. So they sent me to school with gangs. I was bullied for about 5 years. I got 7 O-levels. I was told at my first secondary school, which also had the gangs, I'd not get to Paisley Grammar, which was a better school, and I wouldn't get any A-levels, and I got 5 A-levels. I went to Glasgow University, I studied science, was told I'd not get an honours degree or go on to do a PhD, and I got an honours degree and a PhD. And when I arrived in Toronto via Calgary in 1982, I was told I was nuts working with surgeons and I'd be their lab slave. I guess they were wrong. So I've had to fight to get where I got, and it's been an incredible journey. Chapter 1 is standing on the first tee, so that might surprise you, but if you like golf, you'll know what happens when you stand on the first tee. And so does the book start in a laboratory? No, it begins in a golf course in Toronto, of course.
Why a golf course? Because in 1982 there was nothing behind me in the field, and I was about to study something that was up ahead, and everything in front with hurdles all around it, just like trees and bunkers and deep rough. Other golfers who didn't know me or care about what I was about to say or do. So probiotics was not a term known to many back then. It was poorly defined. Few people believed in beneficial microbes. And I'd just come from New Zealand doing a PhD on the causes of urinary tract infection. And UTI is the most common bacterial infection in the world, accounting for nearly 25% of all infections in women. And for example, in Canada, that's about 500,000 women requiring antibiotics for a urinary tract infection by the age of 24. So lots of people. So this was my PhD. I studied E. coli in 1982 from Massey. And here's the anatomy of the urogenital tract. And the urinary tract organisms, they come from the rectum, they move along the perineal skin, and they go into the bladder through the urethra. And that's how you get infections. And many women also suffer from bacterial vaginosis, BV as it's abbreviated, and that's associated with biogenic amines that cause a foul odor. So triethylamine has a fishy odor, tyramine is a cheesy odor, putrescine and cadaverine. So these are very unpleasant compounds, and it makes women obviously want to go to the doctor to find out what caused it. And these compounds are produced by bacteria in the vagina. So what was it that made me have the shortest postdoc from September to December 1982 in Calgary and moved to Toronto to work with Dr. Andrew Bruce? And you'll notice how young I was and how working for 40 years in probiotics has affected my hair. But back then, Dr. Bruce had just moved from McGill to Toronto, and he offered me the chance to join Raphael Chan and start to work on something that he had worked on in 1973. And he had a paper which came out in the Canadian Medical Association Journal, and essentially she looked at, if you have a history of urinary tract infections, the organisms in the vestibule, urethra, vagina are the E. coli causing the infection. But in healthy patients, it wasn't that, it was lactobacilli. And he was much more interested in saying, why are lactobacilli there and could they be protective? Whereas everyone else essentially tried to stop the E. coli, develop a vaccine or new antibiotics. So chapter 2 is, what are probiotics? You might think that's pretty easy, but let's go through it. Live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. So they have to be live. Administered, in other words, not taken orally. It could be on the skin, it could be for other applications. Adequate amounts, so people that say you need billions and billions and billions, no, you need an adequate amount and you have to prove that that amount is enough. Confer a health benefit on the host, you have to prove it, show it. And unfortunately lots of people don't, but they still call their products probiotics. So you should identify the strains by phenotype-genotype method. In other words, genus, species, strain. In other words, Gregor Reed. And then I would qualify that by giving you my address, my age, who I am, etc. So there's lots of people with that name, but they're not all me, obviously. And then you have to do a double-blind randomized placebo-controlled trial or equivalent human trial with the right sample size and the primary outcome appropriate to determine if the strain or product is in fact conferring a health benefit. And then you have a probiotic. And unfortunately, too many people are not doing that. They're essentially concocting different strains of bacteria and then calling it probiotic, but we'll get to that. So what are probiotics not? This might surprise you, but they are not in us unless you've taken them. And they're not fermented foods. They're not sauerkraut, they're not kombucha, they're not in fermented foods. They're not fecal transplants, as you can't define, or they don't define the strains. It's not multiple strains never tested in humans. In other words, lots of people just say, oh, we've got 15 strains. Well, that's fine. Did you test the strains? Have you put them in for a purpose? Have you tested the product? No, if you haven't, then it shouldn't be called probiotics. And it's not animal studies unless the probiotic is for these animals. So just because someone's done a mouse study doesn't prove it works in humans. And so fermented foods and beverages, they're made through desired microbial growth and enzymatic conversions of food components. They're wonderful. People should be having fermented foods, but they are not probiotics. The only way you can make a fermented food a probiotic, if you had, say, for example, a kombucha, and you described all the organisms, looked into all the properties, and then you did a clinical study with that particular formulation, and you showed it conferred a health benefit, you could call that particular kombucha a probiotic, but people are not doing that. Yogurt is defined as probiotic because it's fermented, slightly acid, often flavored, semi-solid food made of milk and milk solids to which cultures of 2 organisms, Lactobacillus buccaricus, Streptomorpholus, have been added. So the only probiotics only sort of meets the term probiotic for lactose intolerant people, because then they can consume milk, as the bacteria provide the lactase that they don't have. And so that's what makes a general yogurt a probiotic. But please don't think of all yogurts being probiotics for IBS, probiotics for this, that, and the next thing. No, they're not. And there's very few have been tested. Activia, for example, has been tested for transit time. And so you have to look at what studies have been done on that particular yogurt. Prebiotics are a substrate selectively utilized by host microorganisms, conferring a health benefit. So you have to show that the substrate, so for example, you decide to take, say, onions. Well, an onion may contain these substrates, but the onion itself is not the prebiotic, it's the substance in it. And for example, if it contains inulin, which is a prebiotic, you would have to work out how many onions they need to take to have the equivalent of about 5 grams of inulin, because that is what's required for the host organisms to utilize it and then confer a health benefit. So again, people get this wrong. They say, oh, eat bananas, they're prebiotic. No, it's not as simple as that at all. In the book, I give examples of why we can't just recommend onions and bananas. You've heard perhaps of postbiotics. It's a preparation of inanimate, so in other words, dead microbes and other components conferring a health benefit. And they contain inactive microbial cells, so you have to be dead cells, and you have to show the health benefit that comes from it. And unfortunately, this term postbiotic has been misused. And there's obviously reports like this where companies are pushing them anyway. Chapter 3, sharks in the sand traps. And we unfortunately met lots of them. We formed a company to control the patents that we were filing. That attracted people wanting to make you money, us money, and they had no ethics at all. And I give examples of that in the book. People are offering to write business plans in return for half your company. Really? And big industry had zero idea about probiotics and no clue about their potential. And trust me, we went to a lot of the big, mostly pharmaceutical, but consumer companies, and they were, their heads were in the sand, quite frankly. Chapter 4, the need was growing, but science wasn't catching up. So here's an example. Julian Davis, very famous microbiologist from Vancouver. Where have all the antibiotics gone? And the appearance of resistant strains not been matched by introduction of new therapeutic agents, and alternative approaches are required. And so there was a real need for alternatives to the standard drugs that we had been using. And I'm not saying that probiotics are an alternative to antibiotics, but potentially they're an alternative in preventing infection. They're not going to cure an infection like an antibiotic does. But that's an example of the science. The Human Microbiome Project, you'll notice this is launched in 2007, and I emphasize this because this got obviously a lot of publicity, opened the doors hugely for studies in microbiology and the microbiome, which is wonderful. But by the time the Microbiome Project started, I had published over 100 papers on beneficial microbes. And I'm going to just show you some of these. These are just reviews, and you won't have time to read them all, but we wrote about treating diarrheal diseases, urogenital infections. We looked at regulatory issues, urogenital infections again, alternatives to antibiotics, for example, in pigs, probiotics in the intestinal tract, in pediatrics, bacterial vaginosis, the one down below is cited 1,393 times, which is quite incredible. Other ones, anti-inflammatory effects, probiotics for mother and child, surgical in wound infections, taking probiotics during pregnancy, probiotics for the developing world, maternal newborn health. We even talked about symbiotics, and then sub-Saharan Africa, which I'll talk about later on. So in other words, a lot of stuff on the importance of beneficial microbes and the potential to use beneficial microbes to have an impact on lots of things, and even the need to augment the use of antibiotics. So that's just reviews, and then we did a whole bunch of mechanistic studies, so looking at silicone rubber, because that's used in stents and catheters, inhibiting certain pathogens like Enterococcus, how to select lactobacilli strains, inhibiting surgical implant like staphylococci infections, reducing the risk of device-associated infections, which is very common, gut translocation, so people talk about the leaky gut. Well, we were publishing on that in 2002. Improving appetite in an animal study, and sensory properties of yogurt. And then we did clinical studies, of course, and that's orally applied, intestine, vagina, post-menopause, antibiotic-treated patients, various pathogens, and so, a woman under hormone replacement therapy. And so we were doing a lot of things before the Human Microbiome Project came out, and we really believed, and I think to this day it's proven, that there's something to be said for wide application of probiotics. So more and more people, unfortunately, then started turning to the internet for their facts and information. And under Google heading, people also ask, what are the signs you need a probiotic? The first answer, brain fog, decline in memory or cognitive function. I couldn't believe when I read this. Brain fog? You're kidding. That's the first reason people want a probiotic? No, the first reason would be digestive function. Currently, there's no definitive clinical studies showing a probiotic impacting brain fog. So who's controlling the first page options on Google? Well, is this where you get your information from? Is it from influencers? And these influencers, I'm not saying these particular three because I don't know them and I don't know what they write about, but the point is the Globe and Mail, the National Post pointed out that that's where people are turning. And you have to be careful because, here's an example of a so-called influencer. I know about prebiotics and probiotics, but I heard the term postbiotics. And the answer from this expert says, as you may already, probiotics are living microorganisms found in certain foods such as yogurt, sauerkraut, and cheeses. Utter rubbish, complete nonsense. Prebiotics are food for the probiotics. Complete nonsense. Prebiotics are food for beneficial microbes, whether it's probiotics or the organisms inside you. And what are postbiotics? The term refers to waste left behind after your body digests both prebiotics and probiotics. I mean, this is somebody writing in the Harvard Women's Health Watch. I mean, this is nonsense. I mean, and what gets me is I don't understand why Harvard, with its high reputation, wouldn't ask an expert to describe what these things are. And unfortunately, this is an example, and they're everywhere. The Cleveland Clinic, probiotics are made of good live bacteria and or yeast that naturally live in your body. That's incorrect. This is Dr. Ruscio. The signs that you need probiotics. Brain fog. There we go again. Abdominal pain, stool, excess gas, chronic fatigue, sleep disturbances. Sleep disturbances. What probiotics going to affect sleep disturbances? And then mood, depression, anxiety. Well, there's a few clinical studies on this, but please, if you have these issues, that wouldn't be the first time. The first thing you would turn to would be a probiotic. So it's hard. And chapter 5 was staying faithful to self. And I think that's standing up for what you believe in really is a pretty important part of that. And I decided I would do that. And trust me, I was out in left field. I wasn't exactly the welcomed faculty member in University of Toronto. Even when I moved to London, it was still an outlier. But when the president of the American Society for Microbiology says, probiotics may be today's snake oil, fraudulently peddled by hawkers from the back of covered wagons, he got my attention because by then, as I said, I'd published many papers on this topic, and it was disgusting what he said. But then it may not be a surprise because he was deemed an expert on microbes to clean up the Exxon Valdez oil spill. So it seems he's only comfortable talking about oil, but I've certainly never had a covered wagon. And I let him or the others know what I felt about this. There's another one here, probiotics slamming professor, and so you'll see that I responded. This Professor Michael Wilson said that probiotics were basically garbage, and I sent a very thorough response, and you'll see that the advert on the left is kind of ironic. Stand up. Because my stomach acid was certainly going through the roof, and I stood up to, whether you liked it or not, I wasn't prepared to accept irrational nonsense from whoever wanted to say it. Probiotics are quite useless. This is James Gallagher, the BBC. It came from a dreadful study, which I'll show you in a second. And the story was picked up by the press, and it came in JAMA, are probiotics money down the toilet or worse? And you tried to go back to these people and say, look, can we give you the counter argument as to why your article is ridiculous? They don't want to listen. They won't like your reply. The study that they talked about, this is a quick summary of it, and basically volunteers get 7 days of high dose of antibiotics, and then they get 28 days later they got intervention, and 8 of them got probiotics. You imagine 7 get no treatment and 6 got fecal microbiome transplant, and the press release said probiotics after antibiotics will make you worse, based on 8 patients. Imagine, and yet these people picked it up. Maybe it was a slow news day, but they picked it up and brandished the whole field of probiotics as waste of time. And I like to say to people, if you have a headache, you don't take warfarin. Well, warfarin's a drug, and if you have a headache, you should take a drug. No, but you have to take the right drug, and don't generalize the whole field. So the press release said probiotics, meaning them all, don't work, and the story has now stuck around. And recently I read an article about probiotics, and they attached the connection to this 2018 story. This is 2023, 5 years later. They're still referring you back to this ridiculous conclusions. So Chapter 6 is from alternatives to mainstream. Look up alternative medicine. So here's what it defined as: any practice that aims to achieve the healing effects of medicine despite lacking biological plausibility, testability, repeatability, or evidence of effectiveness. Unlike modern medicine, which employs scientific methods to test plausible therapies by way of responsible and ethical clinical trials, producing repeatable evidence on either effect of or no effect, alternative therapies reside outside medical science. And so probiotics are not alternative medicine, and to brandish them as that is, again, ridiculous. And so I don't like that definition. But let's talk about mainstream. So in 1992, our twins were born prematurely, and they stayed in NICU for 5 weeks. And this was them in the hospital. During that time, a baby in the unit died from necrotizing enterocolitis. So you can imagine the baby is premature, low birth weight, didn't come through the vagina, was taken for a cesarean section, has never seen mum's normal flora or organisms, and develops this terrible infection, and essentially their gut swells up, and it's very, very terrible. And a lot of babies die from it, or they get infections that affect them the rest of their life. And that day I said to myself, there has to be a way that we can bring probiotics to that setting so that kids don't have to suffer from NEC. Anyway, I finally persuaded the people at the hospital to do a study, and they looked at 370 infants not treated with probiotics between 2012 and 2014. The incidence of neck was 4.9%. In comparison, after they started giving probiotics, it reduced to 1.6%. Quite remarkable. It led to the hospital here in London introducing enteral probiotic supplementation for infants born less than 33 weeks with a low birth weight. And 6-year follow-up, there was a 74% reduction in the odds of developing neck and no serious side effects. Really quite remarkable. However, one hospital in Canada, I don't know where it is not using probiotics. They have a rate of neck of 15%. I mean, that is absolutely shocking to me. Johns Hopkins Hospital has banned all probiotics, won't let them in the building. I mean, what is wrong with medicine when they can't even look at some of the science and consider this? Maybe they don't want to save the lives of babies, but thankfully there are some hospitals that are using these types of interventions. Research in probiotics do save lives. Here's a way that it can be mainstream. Digestive health is the epicenter of probiotic research. It's obviously the interest of many people watching this presentation. In PubMed, when you look at PubMed, probiotics and digestive, there's 11,290 results. So lots and lots of interest in this. And interesting, of those, there's 812 clinical trials. So this is great because the only way you'll prove if something works is to do the clinical trial. And ideally, you want to do several using the same formulation and the same cohorts of patients. That's not always what happens, but that's the way to do it. Probiotics for hospital patients, imagine. I suggested this many years ago and basically was laughed at. Well, this is 65 polytrauma patients from Germany. They're randomized to receive a symbiotic, which had these strains of probiotics combined with fermentable fibers. Or they had maltodextrin placebo once daily for 15 days. So this is serious patients, seriously ill patients. There was a significant reduction observed in the number of deaths by taking the symbiotic, 5 versus 9. Severe sepsis, chest infections, central line infections, and ventilation days. Now that's 2012. Imagine that we haven't done anything else since then. This is 11 years later. Why are hospitals not trying this? And we were at dinner with the friends the other night and we talked about hospital food and he said, oh my goodness, hospital food's horrible. And that's because the budget for it is very low. And they're certainly not thinking about giving these types of interventions to improve the patient's chances of better outcome. So the field is not only grown commercially, it's grown scientifically. And this is, I didn't update this to 2023, but you can see the point, 39,500 papers. So when I started out, you can see 1982, there was 9. And so this field has just exploded. And, I would not be claiming that all the science is great. It's not, but it's at least people are now trying and doing studies. Chapter 7 is learning how to select a probiotic. In the book, I describe experiments to identify and test microbes that have a probiotic potential. I won't bore you with talking about it here, but I think it's important that you should understand what to look for. Because people ask me all the time, well, Gregor, what probiotic should I take? And I can't answer that question without knowing the history of what your intent is, what issue you'd like to work on, a digestive, urinary, skin, allergies, etc. And I then have to look at the organism and say, okay, here's an organism that has, the experiments have been done on it. They've looked at the genome of the organism and it's got certain characteristics that could well help you for what it is you want to take this probiotic for. And so it's important that we understand the organisms. Unfortunately, what happens in industry is there'll be companies that will make, say, 40 different organisms. They'll dry them and they powder them. And a company will come along and say, well, give me one of them, and I'll put it in a capsule and then I'll sell it. Well, that's not good enough, because you take that, you don't know what the strain's going to do for you, and you don't know if it's the right strain. And so the field, unfortunately, needs to improve drastically, in my opinion, especially from industry. And we need industry, because I can't take a product to market. We need industry to do it for us, but we need them to do the studies and say, this is why the strains that we have got in this product, this is why it will help you for A, B, C, and D. Anyway, rant over. And there's a couple of sites. One is Canadian, one is American. This is a Canadian one. And pharmacists and physicians have reviewed the literature. It's by no means perfect, but it's a great place to go and say, okay, I've got irritable bowel syndrome. What probiotics have had clinical studies that show they might help me? And there's probably 3 or 4. You can go to this chart and then you can try them. Because it used to be you go to a doctor and they would laugh at the thought of probiotics. Now it's good to see the doctors are saying, well, I think you should take a probiotic. But that's not good enough. They have to tell you which one to take and why to take it. And that's going to take us doing medical schools, having courses or lectures on probiotics and the microbiome, which for the most part don't exist, and educational courses for doctors to learn about this, and dentists and nurses and other professionals in the healthcare system, as well as nutrients. By the way, I think nutrition and nutrition science should also be taught. So there are 2 quizzes in the book to see if your knowledge has changed after reading the chapters. Good luck. I think you'll find them interesting. Chapter 8 was overcoming roadblocks. So the European Food Safety Authority, which was given the role of adjudicating essentially probiotic applications, and there was one that was put in for probiotics to help with vaginal and urinary infections. And they replied saying the vagina is considered irrelevant to human nutrition, is not affected by the intestine or by the nutrients we consume. I don't know about you, but when I read that, I just about fell off my chair. How on earth a body can say that is totally beyond me. E. coli, as I said, cause bladder infections, hundreds of millions of women. They don't come from thin air, they come from the intestine. Without nutrients, how's the vagina supposed to survive? It's just amazing. So this is a picture of the European regulators. You can see they're all very handsome young men. So yeah, what can I say? Chapter 9, you'll be happy to hear, is more reasons for hope. And I wanted to leave because the story is about hope, because through all the challenges, there should be hope. And so it's more reasons for hope. And this is Africa. This is in Tanzania. Imagine if you lived there. Imagine if you lived in a place like this, some of the slums around the world. And so why should these people not benefit from things that we've done? And our research breakthroughs need to reach all of humanity, preferably through empowerment rather than donations, and systems that contribute to the different things that cause disease. And the reason I say that is disease is in the middle here, but there's poverty, homelessness, malnutrition, inequality, mental illness, poor education. All these things affect the disease, and so you can't just come up with one solution. You have to try and help people in different ways. And what we did was we developed this. 50 cents. It's got 2 organisms in it. One of them you can see is a probiotic, the GR1 strain. And this for 50 cents, a description of how you make it into 100 liters of probiotic yogurt, or millet, or fermented juices. And you basically teach people, and sometimes people have been familiar with making fermented foods, but you're just sort of reacquainting them with it, because here's fermented foods. There's curd and cheese and butter and milk. We haven't made a probiotic butter or buttermilk or whey, but we've certainly taught them how to make yogurt. And there was actually a cheese that was on the Canadian market that was made with this strain, and eventually got taken off because Kraft didn't know how to market it. So women are leading these micro enterprises. It's changing their lives and those people in the communities through fermented foods. And so that's very refreshing. And I close with another example of what we did is, if insects go, then we go. How scary is that? And plummeting insect numbers threaten the collapse of nature. And of course, if that happens, we're in big trouble. And these bees, these pollinators, are responsible for 1/3 of our food, and yet we're killing them off. And so we decided we'd try and develop a probiotic, not just a probiotic, but also with nutrients for honeybees. And we did that with a wonderful collaboration with Graham Thompson's the bee expert. I'm not. Brendan Daisley is, and these other students are absolutely amazing. And we made this paddy that helped the bees. So final thoughts on the future of probiotics. Humans, I think we're going to see programming, maybe fetal and infant development issues. I think we'll see improved aging. I think prevention of common ailments, diseases in hospitalized patients, improving women's health, hopefully, reaching developed world and poor communities. Other life forms, so we've been looking at salmon, but there's deer, pigs, sheep, cows, chicken. There's animals, pets, dogs, horses. Boy, we need a probiotic that prevents colic because that kills too many horses. Pollinators and diversity. And in fact, I've been writing a document for the Royal Society of Canada, and hopefully it will come out eventually, and looking at planetary health and how we can use beneficial microbes for that. Soil and agriculture, you can replace chemicals and counter chemical toxicity. You can use microbes in the soil. Why not? Why are we not doing that? Anti-pollution, so waste treatment. You know, we have all these drugs are in our water supply. Why can't we put microbes in the sewage plants that break down these chemicals? In fact, why don't the drug companies do that? Because they're the ones that made the drugs that we then pee out into the system. Space travel, it's not going to happen. You're not going to go to Mars unless we solve the kidney stone problem. And also if we use fermentation to provide food on the International Space Station. So these are some exciting areas for the future. So in summary, I wrote about a journey, a concept, so that readers will better understand an exciting field of science that can impact the planet. In doing so, I had to discuss the challenges and the barriers, but in the end we have hope that good will come from how we employ the Earth's microbes, because this is a microbial planet and we have to use them to our advantage. The book ends with references and travel stories, including me meeting Frank Zappa and Jean Chrétien and life as a disc jockey. So I tried to end it with some fun, because at the end of the day, you know, you have a career in science, and I was lucky to have one that was exciting and fun in many, many cases. And certainly I learned a lot about the world and how things are done. If you get a copy, please feel free to leave a review, and thanks for listening, and hopefully you enjoyed the talk.